Hi, I am Linda. If you live with chronic joint pain and have difficulty doing simple tasks, then this video is for you. I shall explain 15 everyday tasks and how you can manage them without much pain. Arthritis is a broad range of 100 different types of joint disease, with osteoarthritis and rheumatoid arthritis being the most common types. Osteoarthritis affects adults and children. That is a result from wear and tear of the joints over time. It can also develop if you have had an injury on a joint that causes joint damage. If it goes untreated, it can lead to a replacement joint. Rheumatoid arthritis is an autoimmune disorder that can affect people of all ages from your grandparents to your children, and causes the immune system to attack the body's healthy tissue, also your organs like your kidneys. It can also affect your joints as in osteoarthritis, but instead of the cartilage being damaged, rheumatoid arthritis attacks the joint tendons and tissues that can eventually cause deformity of that joint. Regardless of the type of arthritis you have developed, the symptoms are similar, which can include pain, swelling, and stiffness in the joints, which can significantly obstruct your ability to perform daily activities. Simple tasks that most people take for granted, such as buttoning a shirt or opening a jar, can become major challenges. Doing everyday tasks can be challenging, but if you break the tasks into smaller manageable segments and take frequent breaks to avoid overexertion. The 15 tasks that may become difficult for you if you are living with arthritis can include: number 1 is getting dressed. By putting on clothes can be a struggle, especially if you have back pain and you wear socks. If you have arthritis in your fingers, it may be difficult to do buttons up, zips, or shoelaces. There are devices such as elastic shoelaces, button hooks, and zipper pull that can make dressing easier. Number 2 is texting. When you text, you are putting stress mainly on your thumbs. Texting with your thumb can cause difficult positioning that could irritate the tendons. When texting, you are putting 12 times the pressure on your thumb joints. Putting this much pressure on your thumbs is dangerous, as the thumb has 60% of your hand function. Instead of using your thumbs, it is best if you can use your voice function key to text. Also, when you text, your head is looking down and in a difficult position, which gives a great deal of strain and pressure on your neck and shoulders. Number 3 is for women. When choosing footwear, you should not choose high heels. They place the foot in an awkward position that puts strain on the ankle muscles and leads to your back being out of alignment. It also puts strain on your knees, as you are placing unsafe twisting moves on them. And this could increase the risk of osteoarthritis and painful feet. So instead of high heels, try sandals or flat heels. When you play tennis, you need support for the side of the foot, so you are not at risk of going over onto your ankles. Also, too much arch support may cause pain and may lead to arthritis. Number 4 is when you carry heavy bags or backpacks on one side. This can cause stress and strain on your neck, shoulder, back, and even your balance is out of alignment, as you are not walking straight. This will give stress to your muscles and joints on that side, resulting in wear and tear on that side. Instead, it would be best if you lightened the load, only carry what you need. If you are using a backpack, wear it over both shoulders. This evens out the balance. Or, if you have a shoulder bag, you need to switch sides occasionally. This will avoid undue stress on one side of your body. Number 5 is if you have to pick up heavy items, and you bend down to pick them up, you are putting strain on your back and spine. You should always bend your knees, but this may not be possible, especially if you have arthritis in the knees. In this case, you should ask someone to lift the item for you. Number 6 is if you have arthritis in the fingers and hands, you may not be able to push a door open, especially if it is a heavy door. It would help if you push the door open with your shoulder. Number 7 is, how do you go to sleep? If you sleep on your tummy, your head and neck are not aligned with your spine, and therefore, will be at risk of straining your neck and back. It is best if you sleep in a natural position, which is on your back. I know that you may snore on your back, but you are in alignment with your spine, neck, and head. Number 8 is another simple task, which is sitting and standing. When I was a little girl, my mother always said, stand up straight or sit up straight. Well, she was correct. When you sit with your head forward, you throw your spine and neck out of alignment. It also puts stress and strain on your joints and decreases joint movement. When sitting at a desk for a long time, you need to sit up straight without bending over the table, as this will give you a backache. If you work at a desk, bring the work towards you, instead of bending over your work. Number 9 is if you work on a keyboard for a long time, you can cause pain in your neck, wrist and elbow joints and muscles around the joints, as well as increased stress in the spine. It is best if you work at your computer for 20 minutes with a rest in between. This means walking around the room or getting a drink. There are devices like a cushioned gel pad for your forearms and wrists that can help you if you have arthritis in the hands and wrists, and your job is sitting at a computer every day. Also, there are computer chairs that are made for people who have back problems. You should ask your HR section if they can buy you a chair or even a back support. Number 10. If you drive, gripping the steering wheel and operating the pedals can be difficult if you have arthritis, particularly in the hands and feet. You can buy adaptive driving aids such as steering wheel covers, pedal extenders, and hand controls that can help you to drive safely and comfortably. Number 11 is doing household chores, such as cleaning, vacuuming, and doing laundry, which can be repetitive movements that can aggravate your symptoms. The best way to clean the house is to use lightweight cleaning tools, long-handled brushes, and adaptive devices that can help reduce strain on the joints while you do your household chores. Number 12 is your personal hygiene, including having a shower, brushing your hair, or brushing your teeth can become challenging due to decreased hand strength and flexibility. It would be best if you have an electric toothbrush and a wide tooth comb, and getting a shower chair fitted can help you to maintain your personal hygiene when you have pain from your arthritis. Number 13 is cooking a meal. Preparing and cooking a meal can be also challenging, especially when you chop vegetables, open jars or cans, and lifting heavy pots and pans can be painful on your hands. There are gadgets on the market that can help you, including a jar opener, food processor, and ergonomic knife that can help reduce strain on your hand and finger joints. Number 14 is climbing stairs. If you have arthritis in the knees or hips, you may find it hard to climb stairs, as you are putting more pressure on your knee joints. This is because when you walk up and down steps, it causes pain in the tender knee joints. This is due to your weight shifting between your legs as you climb. The best thing is to go upstairs with your stronger leg or the one with less pain, and go back down the stairs with your other leg. Always use the handrail to take some of the pressure from your legs. Number 15. The last one is that you should do exercises throughout the day. You should do some stretching, by stretching up on tiptoes for 10 to 15 seconds, holding onto furniture for stability. Another one is leg raise. Again, hold onto furniture and raise one leg a few inches off the ground by bending at the knee, like you are going up a step, and lower it back down. Living with arthritis presents numerous challenges in performing simple tasks, but with proper management strategies and support, you can regain a sense of independence and improve your quality of life. If you have arthritis, you should not just ignore your pain and not see the doctor, as it will become worse and turn into permanent joint damage. By adapting routines, using assistive devices, and seeking appropriate medical care, you can overcome the obstacles posed by the condition and continue to engage in activities that bring joy and fulfillment. Thanks for watching this video. I am not a medical professional, and this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. If you found this video helpful, then please click the subscribe button to follow my channel and press the bell. If you have any questions, please leave a comment below. I hope this has helped you, and good luck.